Hello and welcome to today's interview with one of the I call living legends of medicine and whole food plant-based nutrition. I'm Gustavo Tolosa, your whole food plant-based host, and it is a privilege and an honor to have Dr. Esselstyn with us today for my followers on Facebook, YouTube, and social media. Dr. Esselstyn will follow. I wanted to tell you that we follow you and your wife Anne and your daughter Jane and appreciate your efforts in educating the public. Welcome to this live interview and thank you for making the time to talk to us.
Well, Gustavo, thank you for this kind invitation. I'm more than pleased and delighted to be with you. Years ago, I had a very close friend from Argentina. His name was Rene Favaloro.
Oh, well, that what a friend to have. I mean, I know I read it in your book, one of the
In
greatest.
1963, at the Cleveland Clinic, Favaloro was taking a rotation through cardiothoracic surgery at the same time that I was taking that rotation in my residency. And we became quite close friends. For 3 months, we were on the same service. When I came back from Vietnam and was given a position at the Cleveland Clinic, they decided to put people into the surgical locker alphabetically. And since Esselstyn was next to Favaloro for 2 years, before he left permanently for Argentina, he and I shared the same locker.
Story, I love it. You know, he was he contributed so much to medicine and to heart health, to the world. But of course, in Argentina, he had a very well. The foundation is still going on here in Argentina, and wonderful. Well, thank you for reminding me that. I knew I read it and then I forgot. Very good. Well, Dr. Esselstyn, we have today a topic because almost everybody in this group here follows a whole food, plant-based, SOS-free way of eating. But often people are confused with this topic of cholesterol. HDL for good cholesterol, LDL for bad cholesterol, triglycerides, what doctors consider high or borderline differs quite a lot from doctor to doctor. Could you briefly talk a little bit about cholesterol? And then the second part, tell us the relevance of those numbers for whole food plant-based followers, if there is a difference.
Well, that's a pretty big order.
Okay, well, it's all yours.
Well, I think that when you begin to look at cardiovascular disease or atherosclerosis, one of the first things that really jumps out at you is the fact that we have perhaps known for over 100 years that there are multiple cultures on the planet Earth where cardiovascular disease is virtually non-existent. If you were a heart surgeon and you decided that you were going to hang up your surgical shingle in rural China, Okinawa, Central Africa, the Papua Highlands in New Guinea, the Tarahumara in northern Mexico, no heart disease. Why? Is it because they worry about their cholesterol? How often did the Tarahumara check their cholesterol? So, yeah, it's really, it always comes down to the food. And when we look at cholesterol and you break it down, in the 80s and 90s, it used to think that the HDL was somehow an HDL fraction of the cholesterol was protective and LDL was the bad one. But, some very interesting things began to happen. When I started our first study back in 1984, It was by coincidence, it was mostly all men. Nothing against women. It was just the way that the patients were sent to me. There weren't very many in that. It was a small study, 24 patients. But what happened very rapidly, we noticed that as soon as the men started eating plant-based, their good HDL cholesterol, remember in the United States, the normal level for HDL cholesterol, the low level is 40. In other words, they used to think that if it was below 40, it was too low. Well, suddenly, when I started this study, all the men, their HDL cholesterol started to go down with this wonderful whole food plant-based diet. And and they all went down below 40 and they were in their mid 30s, but at the same time, they were losing weight. At the same time as they were losing weight, they were also losing the symptoms from their heart disease. And when we carefully studied them, now with a lower than normal HDL cholesterol, their disease was reversing with a lower than normal HDL cholesterol. Ornish was noticing the same thing. And so it really was further exciting to think that there was I think it was in about 2006, when Pfizer came out with a pill that was going to end all heart disease. It was called torcetrapib. And torcetrapib, half of the pill was Lipitor, and which would lower your bad cholesterol, and the other half of the pill was torcetrapib, which would take your HDL cholesterol over 100. But as Pfizer was about to spring this on the public, the chairman of Pfizer got a phone call from the head of the monitoring committee who said, "Mr. Pfizer chairman, we have a problem with torcetrapib." And he said, "Okay, what's that?" Well, he said, in the control group, there have been 51 deaths, but in the torcetrapib group, there were 81 deaths. It was killing people. So it never came out, right? Then there was an interesting study by Dan Rader and his team of lipid chemists from the University of Pennsylvania in 2011. I think it was in the January 13th issue of the New England Journal. They had taken 2,000 persons and drawn blood and measured their HDL cholesterol. And there were some that were high, some that were low, some that were medium. Then they did an interesting thing. They took every one of those HDL cholesterols on those 2,000 people, and they measured the capacity of the HDL cholesterol to be able to reverse cholesterol transport. And they found that the capacity of the HDL molecule to do the reverse cholesterol transport had no relationship to the measured blood level of HDL. For example, you could have a very nice high level of HDL, and with that high level of HDL, it might have been very poor at reverse cholesterol transport. On the other hand, you could have a low level of HDL that was very effective. So it was really beginning to bring some questions about what we were thinking about cholesterol. And then there was the team from UCLA in February of 2011. They were looking at the ApoA1 the ApoA1 protein moiety of the HDL cholesterol. They were kind of checking about, and what they found was that when you were eating the typical Western diet, you injured the ApoA1 moiety of that HDL molecule, and you converted it from normally being an anti-inflammatory molecule. And once you injured the ApoA1 molecule, it now became your HDL was converted to a pro-inflammatory molecule, joining with your LDL to injure you. Am I going too fast, or does that make any sense?
It does. It makes sense. Yes. Yes.
Now, so then the other thing that happened is both Ornish and I noticed that when I have patients to start eating this highly anti-inflammatory plant-based nutrition, almost invariably their HDL cholesterol starts to drop. And of course, that for people who are unfamiliar with this, that can be very disturbing. But what it is, that means you're doing it correctly, because as your whole body begins to become less inflamed, there's less inflammation, then the liver recognizes this, and the liver says to itself, I don't need as much HDL, I'm going to reduce my HDL production. And that's what happens with whole food plant-based nutrition. The best demonstration I can have of this, I was thinking about when the late Bill Connor went down to the Tarahumara Indians and measured the HDL, 25 milligrams. Remember now, the low limit of normal for men was 40. Yes. Here they are. These Indians with 25 was their level of HDL, no heart disease. Why? Now that would drive the unknowing cardiologist absolutely apoplectic.
Right.
But it's really a profound demonstration of how healthy the hearts are of the Tarahumara, and they're eating such an anti-inflammatory diet that they have a low HDL.
Wow, that to me that is such a shocking. I've never heard you talk about this before in this detail, and because inflammation is to me is one of the scariest words. I always talk to people about lowering inflammation, and so what you just said about the liver not needing to produce as much. Wow. Okay. Sorry about that.
That's wonderful. I need help.
So
that's pretty much the story on cholesterol, because I've been running a seminar for patients about it every month for those who have cardiovascular disease, and several things that we have learned. When patients are following this nutrition, this plant-based nutrition correctly and accurately, as part of this seminar, many patients have learned long before they ever heard of me, they learned that they could not take a statin, all right? It had too many side effects. It was giving them muscle cramps, or it was injuring their liver, or it was giving them diabetes, or it was giving them brain fog. They couldn't take a statin. And yet, when we published back in a group of 198 patients that we followed for close to 4 years, I published in the Journal of Family Practice in 2014. And we found that even those patients who didn't would take a statin, but follow the program correctly, they did just as well. They did just as well. As a matter of fact, in my book, you'll see that in the several of the pictures, some of the most profound examples that we've had of disease reversal occurred in patients who either refused to take the statin or those who it was actually before the statin came out. I'm thinking of an example of a 54-year-old gentleman and who came to see us in 1986, and he was one of our early participants in the first study. And he had coronary artery heart disease. He had two surgical bypass operations. And in addition, he also had a partially blocked artery in his right thigh. So that when he would come to visit me, to going across the Skyway to my office, he had to stop 5 times because of the claudication in his right calf. And I was and we had we measured at his ankle, we measured the pulse volume of that right leg at baseline. And then I forgot all about his leg. And 10 months later, when he came to see me, he said, "Dr. Esselstyn, do you recall when I first came to see you, I had to stop 5 times crossing the Skyway to your office because of the pain in my right calf muscle?" I said, "Yeah, I remember." He said, "In the last month, it's gotten better and it's gone away." And I said, "Well, then what we got to do is we got to take another pulse volume." So we went back to the vascular lab. They repeated the pulse volume, and we compared it to what it was 10 months earlier, and it was now doubled. And so this is the very infancy, the very beginning of our study. It was very exciting to think that food and food alone could absolutely halt and reverse cardiovascular disease. And we thought that the science was rock solid. And somebody might criticize us and say, "What about the statin?" Well, there was no statin in 1986. So we again had confirmation that this was something that was effective and would work, especially when patients adapted it and did it correctly. Now, I think that the thing that is, to me, is a little frustrating in the treatment of cardiovascular disease is that, with all due respect to my cardiovascular colleagues, I don't know of any of the drugs that they use, none of the stents that they use, none of the bypass operations. In other words, all the therapeutics have not one single thing to do whatsoever with the causation of the illness. And it's very frustrating. For example, many physicians will say, "Well, Dr. Esselstyn, I don't know how you get your patients to follow that diet." And I said, "Well, if you're going to have a patient make a lifestyle change, you've got to show the patient respect. And the only way I know to go show a patient respect is to give them my time. Because when most physicians are seeing 25 or 30 patients a day, and the patient is given 10 minutes, it's not going to happen. What I find is most important is to really to give the patient two separate periods of my time. For example, when we have this seminar, there are going to be 20 patients and it'll all be virtual. But every one of those 20 patients beforehand, my secretary will give me their phone number. And 2 weeks before the seminar, I personally call every one of them to get my arms around their story. And at the same time, give them an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. Now, I should give you an example of what I might say to the patient, because I think illustrates how I try to get them to make this complete transition, which is significant, no question. I would start out by saying to the patient, all experts would agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the really salvation of all our blood vessels, which is that innermost lining called the endothelium. And the endothelium is responsible for making this magic molecule of gas called nitric oxide. And it is nitric oxide that is responsible for the salvation, the preservation, and the protection of all of our blood vessels because of its remarkable function that nitric oxide has. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate, and that's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaques. So literally, everybody on the planet Earth who has cardiovascular disease has their disease because in the preceding decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this. This is not a malignancy. It is a completely benign foodborne illness. And once you can get patients to understand that never, ever again are they to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, because then the endothelium will recover, make enough nitric oxide so we can halt any disease progression, and we often see significant elements of disease reversal. Now, what are the foods that every time they pass our lips, we injure the endothelial cells? They are, number one, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a chip, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells. Any questions on that? I wrote a paper on oil that was published in the International Journal of Disease Reversal and Prevention in 2019. The title of the paper was, Is Oil Healthy? And in the paper, I review the animal studies and the human studies showing how oil injures endothelial cells.
100% clear. Yes.
Also, we want to eliminate anything that has a mother or a face: meat, fish, chicken, fowl, turkey, and eggs. Also, we want to eliminate dairy, milk, cream, butter, cheese, ice cream, and yogurt. I don't like sugar, sugary drinks, Diet Colas, Pepsi, and Coke. We want to avoid sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. I don't like nuts, peanut butter, nut butters, cashew sauce, or avocado, too much saturated fat. And we want to eliminate coffee with caffeine. There's a Greek study and Italian study. Coffee with caffeine will injure endothelial cell production of nitric oxide. All right. The reason that my program will succeed where others may fail is that nobody else is as mean as I am.
You just don't seem mean, Dr.
So now we've got to continue. What are you going to eat?
Yeah.
You're going to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels. All these marvelous 101 types of legumes, lentils, and beans. Wonderful red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. And there are wonderful books out there now with hundreds of recipes that are delicious with this, so that's not a problem. About a decade ago, I made a significant transition in our program that was based upon the fact that the endothelial production of nitric oxide is age dependent. For instance, you never heard of a boy or a girl at age 8 having a heart attack. No, they've got nitric oxide coming out of their ears. But by the time they're age 50, beautifully healthy, they now have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So the two modifications that I made were as follows. First, we had a greater stimulation of the endothelial production of nitric oxide. And number two, we embraced the newer research that shows us that mankind has an alternate pathway for making nitric oxide. So here we go. If you are a patient with heart disease, I need you to chew, not smoothies, not juicing. I need you to chew 6 times a day a green leafy vegetable that is approximately the size of one quarter of your fist after it has first been steamed 5.5 to 6 minutes so it's nice and tender. And then you must anoint it with several drops of a delightful either balsamic or rice vinegar. And why is that? Well, because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. All right. Now, that means you're gonna chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, excuse me. Mid-afternoon is 4, dinner time is 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do? The endothelial progenitor cell will replace our senescent, injured, worn-out endothelial cells. Now, the third benefit, and most important, when you're chewing a green leafy vegetable, you are chewing a green nitrate. that green nitrate is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Now, those bacteria, when they reduce that nitrate, it's going to be a nitrite. And when you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. What you've been doing for minimal expense, no side effects, all day long, dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which has given you this disease in the first place. Now, there is a caveat to this. Toothpaste with fluoride or public drinking water with fluoride and mouthwash will injure the beneficial bacteria in your mouth. Now, and also, I do not like antacids because antacids will reduce your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. The top 6 vegetables would be kale, Swiss chard, spinach, arugula, beet greens, and beets. However, if you want the full group, the whole group, it is bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, napa, cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. And the reason I go through that with you, because you have to know how whole food plant-based nutrition can enhance your memory.
Yes, that's pretty amazing. We can even make a song. As a musician,
Yeah.
maybe I could make the greens song. Dr. Esselstyn, that doesn't mean that a person cannot eat raw greens, right?
No. Okay, yeah, you can do it. Yeah, but there is a suggestion that when you heat them, though, it helps. When you start to chew, you get more. Remember, when you're eating green leafy vegetables, there is a lot of wonderful phytonutrients that are contained.
Right. You mentioned a seminar that you run on a regular basis. How can people know about this and perhaps participate? Is there a website or someplace?
Oh, my secretary.
Okay.
Yeah.
Is that on your website?
Yes.
Okay. All right. So people could go to your website and send them an email.
Yes.
Okay.
Yeah. Or talk, email, or they can call her, whatever they want. Yeah.
Oh, okay. There's a phone number. Very good. You mentioned earlier how sometimes it's frustrating because of your cardiovascular colleagues. I assume that many of them are not well versed in whole food, plant-based, nutrition. So when they look at these numbers for cholesterol, these numbers are for the regular population. How should we, if we really have minimal inflammation and we have a healthy endothelium because we follow, let's assume that we do follow a strict whole food plant-based diet, and our cholesterol numbers are a little higher. How much should we worry about that, and should we consider taking?
I have people close to me for 30 years. They've never had a cholesterol under 200. I mean, some of them, but as long as they're eating whole food plant-based nutrition, I think that what you're building is an endothelial fortress. An endothelial fortress. So even if you've got a few extra molecules of cholesterol going through your bloodstream, cholesterol is not evil. It's really quite essential. But what really gives it an opportunity to be evil is if you have a weakened endothelium. For instance, let's suppose that I've got somebody who comes to our program, and they're worried because their cholesterol is 190 or 210, whatever. But if they've been eating this way carefully, I said, here's what you can do to give yourself some reassurance. I'm going to give you 5 biomarkers that you can get to check your inflammation. 1, oxidized LDL. 2, asymmetric dimethylarginine. 3, myeloperoxidase. 4, TMAO, trimethylamine oxide. 5, HSCRP, highly sensitive C-reactive protein. If all those inflammation markers are normal and nice and low, you should be protected.
Even if the cholesterol is a little higher.
Yeah.
It's okay. Okay, because of the health of the
Endothelium.
Right. Well, that is been always a little bit of a frustration for me, because I do follow the diet that you recommend, and for 10 years, and my cholesterol just doesn't want to go below 200, maybe in one.
But everybody has a different thermostat on their liver for making cholesterol. Some people make. I mean, if some people follow my program 100%, there may be a total cholesterol of 102 or a 120, 150, 180, 200. That's their thermostat of their liver. You're not going to change that. But at the same time, what they can do is keep their inflammation. Right.
Absolutely. That was very good. The markers that you mentioned.
I have one other. I'm going to forget it if I don't say it, and that is, I'll give you an example of how some people normally think. The other day, I was counseling a couple. The husband had a heart attack, and after I was with him 40 minutes or so, went through all what I just went through with you, all about nitric oxide and so forth. And the wife then looked at me and said, Dr. Esselstyn, you haven't talked to me yet. What are the cheat days? I said, would you spell cheat? She said, CHEAT. I said, okay. I said, you mean if your husband is good all week long, that he should then on Saturday and Sunday, he can eat what he wants? She said, yeah. She said, that's right. I said, now think of what you just said. You've tasked 104 days out of 365. Your husband is still trying to destroy his few remaining endothelial cells so he can have a second heart attack. Oh, she said, I didn't think of it that way. But that's the way. There is no thing as 90%. That if you're following at 90%, that means 10% of the time you're trying to further destroy an already destroyed endothelium.
It makes no sense. Why would we want to damage this very important part? Dr. Esselstyn, how do triglycerides fit into this picture? A lot of people report that their triglycerides are higher actually when they switch to a whole food plant-based diet. Does that have to do anything with sugar or?
Yeah, sure. A lot to do with simple carbohydrates. Almost always with simple carbohydrates, people start smoothies. Smoothies will really often raise your triglycerides. Will do it. A lot of fruit, dates, and of course, we never want people to have fruit juice. When they start having fruit juice, that'll do it as well. And then alcohol is notorious for raising triglycerides. Yeah.
Okay. Alcohol. Very good. Would have Dr. Esselstyn, how about something like, I have received this question a few times, so I need to ask you because I've never heard of this. Something called berberine. Have you?
You got me there.
Okay. It's spelled BERBERINE, berberine or berberine. I don't know.
What is it?
It's supposed to be some sort of a supplement. Maybe if anybody would like to write it here in the chat, that supposedly helps with lower cholesterol. But maybe while we wait for that, someone asked me to ask you the importance of APOB, apolipoprotein B. I don't know if that has to do anything with cholesterol. Apolipoprotein B, APOB.
Well, unless I'm confusing this with the moiety part of the HDL molecule, ApoB is a more aggressive side of a more aggressive side of LDL.
Okay. I think that's what the person wanted to have a little more explanation of what it is and what it does.
But I think the important thing is we can often get ourselves tied up in knots with this disease. When you think that it's so shameful that the American Heart Association was formed in 1924. The American College of Cardiology was formed in 1949. Why haven't they brought the diet of those cultures where heart disease is non-existent? Why not bring that culture to this or that way of eating to this country? Because the answer to this disease is not stents and bypasses and drugs. The answer to this disease, let's not forget the dignity of simplicity. It is the food.
Exactly. Yes.
Yeah.
Well, that's what I always tell. I do webinars and I do cooking demonstrations and other things. And I always talk about the simplicity of this. We human beings somehow want to complicate things. And it's natural, but it's the food. So for example, taking a nitric oxide supplement is probably, it's just go with the food, like you said, chew your greens correctly.
Yeah.
They do. I was surprised to see that as somebody came up now with nitric oxide supplements. So you, again, just popping a pill, and hoping that will do the job.
I think there are two companies that make pills, and I guess what I'm waiting for, I want to see where those pills are put to work with a group of patients who are seriously ill with cardiovascular disease. And if they can halt the disease and reverse it, then there might be something that can be considered. Also, I don't want to hear about it after they've tried it on 100 patients. I want to know what's happened after it's been tried on 3,000 patients.
Right.
That's when the side effects really begin to come up. It may be perfectly safe, but we don't know until that's done.
Right. Dr. Esselstyn, somebody was asking here, well, this is a very interesting question. Okay, this is a 75-year-old person and have been prescribed a statin drug by my physician. Even though my cholesterol is excellent, I have no known heart issues and maintain a fairly healthy plant-based and physically active lifestyle. My physician has based this decision on my family history, brothers and fathers who have died of congestive heart failure. And so that's how it was based. And the person is saying, just because members of my family had this issue, but I have good health and good cholesterol, do I need to take a statin drug?
Well, one of the things that I've learned over the years is to be a little bit delicate when somebody is trying to position you in an awkward position of driving a wedge between the patient and their outside physician. but I think it's very important for whoever that patient is to respect the feelings and the understanding that he is trying to bring to that situation. But on the other hand, I think that what might help settle the issue would be to get a calcium score. And if your calcium score is really quite normal, because what I've heard is you feel well, but I don't know that we've got any hard data. And really, if you, I'm talking to the patient now, and if you have been eating any of the typical Western foods, oil, meat, dairy, and if you're over the age of 17 or 18, you already have coronary artery disease. We know from studies of the pathobiologic determinants of atherosclerosis in the young. An interesting study where they took patients who were between the ages of 17 and 34 who had died of accidents, homicides, and suicides. And an autopsy of these patients, early coronary artery disease is ubiquitous, everybody. Now, not enough for their cardiac events yet, but we think about it. By the time they're in their late 40s, that's when we begin to see this tsunami of cardiovascular disease. Yeah.
Okay, very good. Do you recommend any types of supplements besides B12?
Not at the present.
Okay.
You can get some sunshine to keep your vitamin D up. If it's too low, you can always get a supplement. But you ask yourself, what are the supplements that the Papua Highlanders are taking, or those in rural China? No heart disease. Yeah, but I think if you're going to eat plant-based, I would like you to have some B12.
All right. Okay. One more question, because I know we've gone over, but there's an interesting question here. I understand there is a difference or two types of LDL, LDLA and LDLB. If you are on a whole food plant-based diet and your HDL is 52, triglycerides 80, but LDL is 166 for a total cholesterol of 260, something brand new as traditionally around 180. Is this a concern? Why would it be so lopsided given?
What is the patient eating?
Right. Well, that would.
Are they eating an Argentine diet?
No, this is supposed to be, this person is here and they can answer in the chat here. If you could speak, it says Beth. And I think she's whole food. She says whole food plant-based for 3 years.
So not a drop of oil.
Yeah.
No,
I don't know.
No dairy. No animal protein, no sugar. And what's the one that's so high?
So she says that she has nuts.
Nuts are loaded with saturated fat. That'll certainly that stimulates your liver to make more LDL cholesterol. Yes.
Right. So the LDL is 166, and the total is 260.
Yeah, that's elevated.
Right. Right. So would you recommend that she tries to eliminate nuts and seeds at least?
Yeah.
Okay.
Because that's if they want to follow the program that I suggested, I made it very clear today that the nuts are not a part of it.
Right. Right. Very good. Well, do you or your family do you recommend products that have flour, any kind of bread that is healthier than others?
Well, here in the States, yeah, there is.
Perhaps the Ezekiel, I think it is
That's
called.
exactly right. That's what. Yes, it is, because it has. It's not on the sodium.
Right. Okay, but what about a heart patient? You don't recommend any bread, correctly?
Well,
Or maybe some.
I've providing that the bread isn't loaded with oil
Uh-huh.
uh, or salt. Yeah, then I don't restrict it. And if you have a cracker, what we often will do is you take a pita bread, the one without any oil, bake it,
Uh-huh.
and then just hit it, and you got crackers.
Right. No, that's very good. And even though we didn't talk a lot about sodium, sodium it also injures the endothelium.
Well, I'm not sure I can see. All of us have to have a certain amount of sodium,
Right.
but I think when we overdo salt, now we get into hypertension.
Mm-hmm.
And hypertension is an absolutely terrible, terrible, terrible disease. Because even if you haven't had a stroke by the time you're 75, if you've had years of hypertension, you have a much greater propensity to have dementia.
Right.
And that's just horrible. I mean, dementia is absolutely very, very, very challenging to a family and to the individual. And I've had colleagues that are somewhat slightly more senior than I, who have it's as if their brain has perished.
Right. Right.
And it's tragic.
It's tragic, exactly. Would you mind one more time, although this is recorded so everybody here could watch the recording, would you mind mentioning one more time those markers, those type of tests that you
All right,
recommend?
let's do it. Oxidized LDL, asymmetric dimethylarginine, myeloperoxidase, TMAO, trimethylamine oxide, HSCRP, highly sensitive C-reactive protein. That should be 5.
Correct. That's 5. All right. Thank you. Thank you. Very good. Well, we hope that this has been helpful for everybody here. And thank you, Dr. Esselstyn. And if people would like to get in touch with your secretary, your website is actually
dresselstyn.com.
Right. So please go there, because I know that we couldn't go through all the questions that everybody posted here, but you can contact Dr. Esselstyn's secretary. And perhaps you will be one of the lucky ones to get a phone call from Dr. Esselstyn. Very good. Well, thank you again. And I hope you have a wonderful day.
Thank you, Gustavo. All right. Ciao.
Ciao. Bye-bye. Hasta pronto. Bye-bye.
Okay.